Good morning. Thank you very much for the introduction. So as we know, several million of people over the world suffer from underactive bladder. And also we know that catheterization is often used as a treatment for these patients. But we also know that there are several side effects associated to catheterization, such as bleeding, discomfort, pain, and last but not least, urinary infections. So considering that catheters have been used for the last 3,500 years, we as bioengineers, we thought that there could be some room for innovation. So our aim is to develop and establish a new technology which can empty the bladder with the following advantages. So first of all, be non-invasive, and then also able to generate a flow without touching the fluid inside. So in this case, the urine. Therefore, we want to drastically reduce the risk of developing urinary tract infections. But how do we do this? So with our experience, we thought that the impedance pumping could fulfill all these requirements. And how does an impedance pump work? So if we have a tube, a flexible tube, we start hitting the tube, pinching the tube at specific frequencies with a specific pattern, we can generate a flow, such as the video that you see on the background. But what is more important, we are able to generate the flow without touching the fluid. Just think that this could be the urethra of a patient. So in order to test our hypothesis, we place ex vivo bladders and uretras from pigs on a stage, and we consider as our impedance pump a simple linear motor who could pinch the urethra at 3 different sites and at 3 different frequencies. During the experiments, we were able to record the pressure, intravesical pressure, to show that everything was safe for the bladder. At the same time, also the generated flow, using a weighting scale. This is how a typical waveform looks like. So in the beginning, we have a flow, some initial passive flow, because we fill the bladder with 120 milliliters of water. But as you can see in the green region, as soon as we activate our pump, we could see a steep increase of the flow, reaching a maximum, in this case, close to 5 milliliters per second. And that was followed by a decay. Well, what was more important is that we could always reach complete bladder emptying within a few minutes. So what we have shown is that we can use impedance pump to empty bladders. We can reach complete bladder emptying. Then pressure were always, during experiments, below 10 centimeters of water. And this showed that it's safe for the bladder. And this could be a valid alternative for patients suffering from underactive bladder. So where are we now? So we are in the process of incorporating a startup, a spin-off of the University of Bern. And after filing 2 patents, we have now a prototype ready for clinical trials. Thank you.
Thank you very much. Questions, please?
Govert van Koeperingen from Maastricht. A very, very nice idea. Thank you for explaining this to us. Are you not dependent on the compliance of the bladder which is above? I can imagine that if you give a frequency to the urethra and you have a very flaccid bladder above that, it's very difficult to expel urine to the right side. It could very well be that nothing happens.
Well, we need to test in patients, of course, but our idea is to have some knobs that can be optimized for each patient. Because what we notice, and also how the impedance pump work, is not only depending on the site, but also on the frequencies. In fact, changing the frequency, you can reverse the flow, as you mentioned. But
or can you, in your setup, can you just empty a plastic bag without any tension?
Yeah, we did that.
Can you show that?
We did that, yes.
Okay, interesting.
That was our first experiment.
Yes, please.
Hi, Irina Zabarova from University of Pittsburgh. So from what I understand, you implanted this pump inside the animal.
So it can be an implanted version, but our idea is to have something that the patient carries in his pocket. When it's time to go to the loo, they can plug.
No, I understand, but my question is rather, was this pump implanted before the sphincter towards the bladder or after it? And since you used the female animals, from what I understand, their sphincter is quite it's not very strong, and I wonder if the flow can just
So
go
in our
through.
case,
And
we didn't have the sphincter, and we simulate the sphincter. So if I go back, you can see there was a certain elevation of the urethra. So in this case, we are simulating the obstruction with this angle.
I see.
But there was no sphincter, so it was just bladder and the urethra.
Oh. These are females. Yeah, I understand. That's why I'm asking where it was. That's why I want. No, I understand that.
Well, that's Mike Ruggieri from
Please.
Philadelphia.
Okay. Yeah.
That's
Last
kind of
question,
my
please.
question also. You've only done this in an in vitro setup. Have you ever done it in an in vivo? I mean, even in vitro, unless it's done immediately after removal from the animal, there's probably very little tone in the urethra at that point. So what in the in vivo situation, there's going to be urethral tone. How do you envision this device working in vivo to pump fluid around a urethra that's closed?
Well, so we have conduct all the experiments ex vivo, so using bladders. There are bladders. The idea is like to conduct in patients, and then we are going to use ultrasound to show that if our pump can really empty the bladder. So this is a future work.
Last question,
kinda
please.
negates
Very
what
last
we know
question.
about.
Sorry.
Yeah, Lawrence Stewart from Edinburgh, Scotland. I mean, it's a very nice idea, and I'd love it to work, but I agree with the last questioner. I mean, in humans, you've got a intact sphincter, which is going to keep the urethra closed, and I think, therefore, pumping on the urethra itself may not produce any flow.
Well, the idea is like the patient will start voiding, so we'll have the sphincter open, and then like
Why? Why would the patient start voiding?
Well, we have to define all the protocols, but this could be an assist device for voiding. So a patient that cannot empty the bladder can start the flow and then can activate this pump for that can lead to a complete bladder
I
empty.
hope you're right. Thank you.
We will see.
Okay, thank you very much.